The problem for Shanghai is there is almost 25 million people there. It is the biggest city ever to have been locked down since this global pandemic began. It hasn't been locked down previously over the past 2 and a bit years. And because of that huge population, authorities have decided that they're going to lock half the city down over the next 4 days. They're dividing it along the Huangpu River. And then they're going to put those restrictions on the other half of the city for the subsequent 5 days. Now, why are they doing this? It's because they're carrying out compulsory mass testing during this 9-day period. So for the first half of the city, it's work from home. They're suspending the operations of many businesses. They're suspending transport. They're taking cars off the road. Obviously, there's not movement going in and out of the city. The only thing that is operating more normally is food supply and essential services. So it's basically a lockdown. And while they do that, at the residential compound level, the local, I like to call it like a strata committee, but it's the local building or community management. They will be going around and getting everybody, building by building, compound by compound, to come out, line up, do the nucleic acid tests, and they will repeat this. And so this is the reason, Bev, why they're not doing it in one go, simply because the resources needed to test roughly 12.5 million people and then another 12.5 million people just makes it better to do it in 2 different stages.
They have also said, though, that Shanghai is a city that's too important economically to go into a complete shutdown. How much is that playing into this approach?
Well, they said that, and then they reversed course, and now they're locking it down. This was the rhetoric only a few days ago. In fact, police in Shanghai said that they'd punished a couple of people for spreading rumours that the city was going to go into a lockdown. Well, what's happened? They've announced a lockdown. So there was this idea that Shanghai was a bit different, that Shanghai's local government had its own way of dealing with these sporadic COVID outbreaks that did not involve citywide lockdowns, very targeted approach. Only the specific communities or the buildings or workplaces involved where there were cases and close contacts were locked down and targeted previously. But this time around, you now have a daily record of 3,500 cases in Shanghai, more than 6,000 cases across China. I know these numbers don't seem big by Australian or global standards, but when you are trying to pursue COVID zero, it is a crisis. And that's why I think authorities felt they had no choice but to implement a lockdown.
And Bill, given it is such a unique thing that they are trying to do, there's a British woman that's documenting via social media what it's like having COVID in Shanghai. Tell us what you've been seeing on her posts.
Yeah, Bev, it's actually a really rare insight. It's a woman named Emma Leaning who actually works for a Shanghai state media outlet. Her husband too. He's in this isolation centre. The two of them have COVID, like quite a few people now in Shanghai, and they were brought to the expo centre, which has been set up in what basically is a field hospital. There is a capacity in there of close to 7,000, and people who have COVID are being forcibly taken there, where, according to her posts, the conditions are not great. There are portaloos with automatic flushing that doesn't work for the squat toilets, so apparently the toilets are filthy, according to her videos. At night, the lights are on. You're sitting or you're lying in a bed in a room with 6,000 or 7,000 people around you. Many of them have symptomatic COVID, so they're coughing. There's no shower facilities available, so she's posted pictures of a bucket and a rag that they give everybody to wash themselves. And this is where people with COVID will remain sometimes 2 or 3 weeks until they are able to clear the testing. And so this is an idea of what this lockdown and COVID zero approach means. And you can understand, Bev, that a lot of frustration now is starting to creep out in China. We're seeing it online. We're seeing it in posts that people from various parts of the country are publishing. And the reason is, if you do have asymptomatic COVID, if you do have a very mild infection, and then you're forcibly taken from your home and ordered to stay at this centre for the next 2 weeks where the conditions are not great, understandably, that's a very different situation to what people with mild COVID have in Australia, where they're just told to isolate at home. Yeah. So a very interesting insight, and you can understand, looking at it, Bev, why particularly if you're not Chinese and you're staying in Shanghai as an expat and you're very familiar with the conditions back home in countries like Australia or Britain, where COVID is now pretty much normalised, it must be a very bizarre experience.
Indeed, and then we're also hearing reports that some companies are asking employees to basically sleep at work to avoid the lockdown. So that, you know, it's very uncomfortable either way you look at it.
Yeah, that's right, Bev. We've been seeing pictures of some companies that are rolling out the temporary bedding for employees to stay there. And it kind of makes you aware of what a crisis this is, given the huge amount of inconvenience that is going to be happening to the city for the next 10 days or so, but it probably will linger. It's not as though they will be able to extinguish COVID in such a short period of time. And you might be wondering, why don't they just flick the switch by this point and try and implement policies that allow some form of coexistence with the virus? Well, only a couple of months ago, the Chinese government's official line was, you cannot live with this virus. It is too dangerous. There will be too many deaths. Any level of deaths is unacceptable, and that's what makes the Chinese approach superior to what they have in the West, where many, many people have died of COVID. This officially is still the line. This is still the policy, pursuing zero cases, but we're starting to see, Bev, a little bit more public discussion from commentators, from government academics, suggesting that there needs to be a bit more flexibility and that they need to be able to take on Omicron and try to contain it at a lower cost to the overall society and economy.
Good to talk, Bill. Thank you so much.
Thanks, Bev.